Ranyika, let's talk about this in three different ways. There's accessibility, there's affordability, and there's standardization. Let's start with accessibility. What is the best way to ensure that people have access to healthcare? What should we do? Should we have dispensaries in each and every sub-location? What happens?
When you talk of access, there are two issues in one. One is financial access. The health services may be there, but you cannot access them. You may be living next to a private hospital,
but you can't afford it.
Yeah, you can't afford it, so you don't go there. The other one is physical access.
Yeah.
Are the facilities there? Now, in terms of financial access, that is where insurance comes in, social health insurance in particular. So let's assume that we do that, then we now have finances to cover so that everybody can go in. We can go into more details about that. Physical access is also important. It's not just the physical facilities. First of all, we should make sure that across the country there are physical facilities which will be used to provide the services for which will be paid for by the insurance, so that across the country we must have the facilities. And now in this country, we actually have levels of facility.
Yeah.
We have level 1, which is actually the community, probably the most important one, because that is where primary health care takes place. That is prevention of disease,
yeah,
promotion of health, and early detection of illness, and quick treatment, which is always cheap. So that is actually what will control the cost. But leaving that alone, what most people think about is level 2, where you go to small facilities that take good care of you. Level 3, where you can get some deliveries and so on, so a little more complex. To level 4, which is what used to be district hospitals, where you can get virtually almost all levels except very specialized care. This must be available across the country.
Yeah.
In physical terms. And in my view, if you are looking at in a successful system, we should not just be thinking of public hospitals. There should be public facilities. There should be public facilities. There should be private facilities and faith-based facilities.
Yeah.
And if the payer is one, that should make it possible for people to access all these. Maybe in private facilities, they may have co-insurance or co-payment, yeah, because the universal cover may not, as it is, the insurance may not pay for that. But those facilities must be there. If they are physically there, and international standards is really nobody should travel more than 5, in the rural areas in particular, more than 5 kilometers, yeah, to the nearest center. If we can get that available, and it is possible in this country, yeah, in the devolved system, physical facilities are actually there. And I think we can put more. The governors can put more. Yeah. And they've actually tried to do that. Now, what then comes next? It is physically there. Mm. Are there people, health workers, who will take care of you in a proper, with the skills that are needed, yeah, with the human approach that is needed for sick people? 3, are there the supplies that they need? And if you go higher up the levels, are there the equipment that they need?
Yeah.
So that is really something that we must work on. And over time, we have been working on that. You hear programs that support level 2 and level 3. You hear of programs that support level 4, and you hear of programs that bring in equipment like the MES. They have their problems, yeah, but it is an effort that is there. So we must make that available. Yeah. It is achievable, yeah, but we have a problem, as you said, of standardization.
Yeah.
Again, that That is now with the national government, the Ministry of Health.
Okay.
There have to be standards.
When we say
level 3,
yeah.
It should not. We are not just talking about public facilities.
Yes.
Even in the private, there should be that equivalent. Faith-based should be equivalent.
Okay.
At that level 3,
yeah,
you should get the same services across.
We'll come to standardization in just a bit. Let's finish up with access first. Dr. Davji, what is the main issue when it comes to access in your own assessment? Because I know you've been in this industry for a while.
I think the main issue of the access so far within the hospitals will be the human resource aspect of it. I will say, as my colleague Dr. Nikalas explained, that you realize that there is the infrastructure, that is the hospitals, the brick and mortar. The governors have actually done very well in that, in building and ensuring that there are hospitals everywhere. And we have them as level 1, 2, 3, and 4. But their levels up to the maximum, up to level 6, is not based only in terms of the size or the sophistication of the building, but ideally it should be based on the service that they're able to provide. And this is based on the human personnel, the human resource that the human resource that they have. Like, for example, a level 4 need to have around 60 doctors, around 100 nurses, clinical officers, but you'll see that in most of these particular hospitals, mostly the public hospitals, there will be levels as level 3 or level 4, but the number of the personnel in them will be, I would say, 10% or 15% of the numbers that they need to have to offer the services. And at this point, somebody or a patient will go to get services, but they will not. They will have to be referred to higher levels or to referred to a nearby private facility. And in that regard, that will not be the right access to healthcare. And as Dr. Nikala also explained, in this context of accessibility, we have the faith-based, we have the private sector, and also we have the public. But majority of the Kenyans will first of all go to the public sector to get services, whereby they will expect to have the disease that they have, get diagnosed, they get the drugs, and they get the services holistically. But many a times, they will end up, I think about 73% from the last statistic that was indicated, will end up going to visiting 3 or 4 facilities before they get the issue sorted. Basically, because of lack of the personnel that are required, or the hospitals are not well equipped to offer those particular services they need. Okay. So I think that, in a great extent, interferes with access to the healthcare.
Okay.